Ready? Good morning, Mojave County. I'd like to call this meeting to order. It's the Mojave County Public Health Department Board of Health meeting for January 22nd, 2024. So we're starting out the new year this morning. We'll begin by saying the Pledge of Allegiance to our country's flag. Please join me. Pledge allegiance to the flag of the United States of America,
of America, and to the republic for which it stands, one nation, under God, indivisible.
liberty and justice for all. Thank you very much. Do we need a roll call?
Sure. Hunter Adams,
Hi, I'm here.
Terry Coyle,
Present.
Robert Leitz.
That's Litz, and I'm here.
I always do that, I'm sorry. Robert Litz, thank you. Byron Stewart. Present. Nancy Mongeau. And we will excuse Nancy for health issues. Jean Bishop,
I am here.
Dr. Nguyen.
I'm here.
Citizen members Kal Sheehy
Here.
and citizen member Sandra Thomas. And also excused for a family funeral, and Dr. Kingsley present as secretary. And we have quorum. Thank you.
Okay, we're going to begin today with the call to the public. Do we have anybody that signed up to address the board? Okay. Seeing none, we'll go into presentations. And at this time, I have a request to move agenda item number 8 up to the beginning. They have a presentation and also an agenda item that will be discussed after the presentation. Good morning. Always nice to see Mojave Community College in our auditorium.
Good morning. Thank you for having us. Good morning, board members and member of the community. My name is June Weiss. I am the Dean of Health Professions, Human Services, and Public Safety at Mojave Community College. And with me is Veleda Lemos. She is the director of our new respiratory care practitioner program, and she would like to take just a moment of your time to fill you in on the expectations of that program for the community.
Okay, lovely.
Thank you.
Thank you.
Good morning.
Morning.
So yes, this is the Respiratory Care Practitioners Program. We are in the progress of developing the program. It's quite a lengthy process. I submitted our letter of intent on Friday of this last week. The letter of intent is a initiation for that process. We have assembled an advisory board with 11 members, Dr. Nguyen, of whom is the medical director for the program. The education plan, it's going to be an 18-month program with 288 hours of didactics, 192 hours of simulation and laboratory work, and 630 clinical hours for a total of 1,110 hours of educational process. The program is going to be based at the Detroit Avenue Center. That will be our base program. That's where the didactics and labs and simulation will take place. Our clinical affiliates are Kingman Regional Medical Center, Western Arizona Regional Medical Center, Valley View Medical Center, Havasu Regional Medical Center, and La Paz Regional Hospital. The provisional plan for the program is that it will start hopefully with accreditation approval in the fall of 2024. If that does not happen, then we will start in the spring of 2025. The process is that once the letter of intent has been submitted, then we get what's called a referee, and then they come out and they tell us what it is that we need to do in regards to that letter of intent. And then once we're able to get that all taken care of, then we can actually submit our self-study reports, and from that self-study report, they would hold another meeting in July, and hopefully we would get approval of the accreditation at that time. If we do that, then it will happen in fall of 2024. We have requested facility. We, of course, myself, we will be requesting a director of clinical education. The reason that we have done all of this is because one of the facilities in Mojave County has requested it. We also know that post-COVID, we had some severe shortages for respiratory therapists, and so we needed to make this happen so that we won't find ourselves in that condition again. Labor market information has also supported that we need this. And then we have gotten the statement of support from all of the board members. So how can you help us? We are asking for the board to provide us with a letter of recommendation that we can supply to the COARC organization, that is the Commission of Accreditation for Respiratory Care. And with your support, we hope to be able to make this happen. Should anybody have any questions?
Okay, thank you very much. It's an exciting presentation. I'm so happy to see this being done. Do any of the board members have any comments or questions for,
Yeah, I just want to say that, from our community health needs assessment from 2022 and beginning the process again, but we have identified previously that respiratory diseases and lung cancer is the primary cancer here in Mojave County. And we do have a higher incidence of tobacco use and respiratory and COPD. So this is something that is very beneficial for our community for the long run, but be able to provide these services and respiratory care. And that can also be used in many other places, and we look forward to perhaps even integrating with them and perhaps providing a respiratory, the students on our mobile unit, and also being able to provide it out into our community. So we're excited for this program to be able to advance forward.
anyone on the phone have any questions or comments?
No.
Okay, but thank you very much. So
Thank you so
we'll,
much. Have a blessed day.
thank you for the presentation. I'll, with the board's approval, which we'll discuss here now, I will be happy to sign that letter for you.
Fabulous. Thank you.
Have a great day.
Tony, do you need a board action for that?
There's an agenda item number 8.
And we'll do that with
does
that.
say
Okay.
Discussion and possible action regarding the approval of the community college.
Okay, all right, okay.
So I'm looking for a motion.
Okay.
Did you make a motion, Gene?
No, I didn't. I'm opening it up for a motion from
I'll make the motion.
Byron.
I would like to
The
excuse myself.
Authorize them to go ahead with the program and approve our support.
You have a motion and second?
I actually would like to excuse myself because I'm helping out with the program.
Okay. Okay, so we need a second then?
I'll be second. Terry Coyle.
Okay, we have a motion and a second. All those in favor indicate by saying aye.
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 Any opposed?
Aye.
The chair votes aye. It looks like it's unanimously approved, and we will get that letter signed for you today. Okay, we'll go on to the next presentation. This will be from the Mojave County Medical Examiner's Office. Mr. John Hassett is here to provide us with the presentation and information. Good morning, Mr. Hassett.
Morning, ma'am. Good morning, ma'am. Board members, ladies and gentlemen. That's mine? That's mine.
Yep.
All right. There we go. Okay. Will it go up on there?
Will, yeah,
Okay.
we'll transition it.
So Dr. Kingsley wanted me to make sure that I wasn't going to go slide by slide, page by page, note for note. So we'll do a summary quickly, and if you want to stop me to elaborate on anything, by all means, please do so. As you know, we've made a lot of technological advancements and things on how we operate the medical examiner's office. We have implemented what we talked about, what I spoke about last time, which is MDI log. It's a national system that is designed specifically for medical examiner divisions. We were told about it by Maricopa and Pinal County, some of our partner departments that we work with, and we have implemented those systems within our own office. They've proven to be a very beneficial add. Our investigators are now doing paperwork on scene with their Surface Pros and tablets and being able to give real-time data. We're fingerprinting on scene, and we're able to identify more quickly any John Does or with a system that we integrated with DPS. Our locums doctors are able to work remotely through MDI log. We are still perfecting some of they're continually upgrading and giving us advancements within the technology, and we are continuing to work with that, and we can dive down deeper with demographics and analytics by what we integrate into our investigative reporting and what we integrate into our autopsy reports. So it's able to provide us with a lot more information, and the more information that we feed into the system, the better reports that it will kick out for us when on an annual standpoint or any kind of question standpoint. Just clicking through this. 2023 cases year over year. Total case volume, we're actually down 9% 2022 versus 2023. 2023 was on trend with prior years 18 and 19. I have footnotes on my paper, so I'm just making sure that everything matches here. So that's why there's a delay in that. So my apologies. Bullhead City and Kingman regions have always been higher rates of passings compared to Lake Havasu. We broke it down. The amount of autopsies, cities of passing is where I'm at now. This is broken down by every location within our county. We still have 11 cases pending for 2023, and when we say pending, it's not that they're in our office, it's that they have been released and back to families. We're just pending a cause of death based on toxicology. I'm going to go through, you can see on the computer, correct? It's also the same what's printed in front of you. All right. So 2023 natural deaths. We were asked at our last Board of Health to break down a little bit more demographics, male to female. So gender, race has also been broken down. Suicides, based on the information that we have collected, suicides are predominantly male, Caucasian, 65% were firearm, use of a firearm. Homicide victims, primarily Caucasian males. Again, firearm was the cause. MVAs are a primary accident cause. Meth is a primary drug used from an overdose cause of death. Combined with meth and fentanyl would be the third.
So looking at that one real quick, if we mind pausing there just for on the 2003 accidental deaths. So these are questions that we kind of received media-wise, but as you can see, if you go back to the other pie chart, one with all of them, accidental deaths.
Can I go back?
Or forward, please.
Oh, I got it. Nope.
I think it's that one.
Okay.
So looking at that one there, so we see, the first, if you start at the top there and kind of go down more than a fourth of it, you got alcohol, fentanyl, methamphetamine, combined narcotics. So about a fourth of our deaths that we're seeing are dealing with substance abuse disorders. which is why we have opioid settlements, but as well as, what we're being addressed here. The other, as we saw during the summer, which we know, but, it's getting a lot more attention nationwide. Heat is something we've always dealt with in our county. Right now, previously I would say the northern states have always dealt with hypothermia, freezing. Not something that we've had here, but now heat is taking a big stage. So we do see some of our hyperthermia deaths there, then injuries and trauma, firefall and others. But so this is something that, yes, we've seen, it's reflected what's going on within our community. We know we're experiencing these substance abuse disorders and the resulting deaths from that. And then hyperthermia as well, the heat during our summers. We didn't see a large spike over the years before, but we see an annual increase a little bit each year with hyperthermia, and some of those are tied to substance use. But I just wanted to kind of give a snapshot of what we're seeing there. And this is what we've seen the past years, but these are kind of our big indicators here of our public health issues that we're facing.
And when we get to the weather-related, you'll notice that you'll see that it was on par with that massive heat wave we had in July. Hyperthermia deaths peaked to, I believe, 32. Yeah, 32 in July, as opposed to 1, 2, 10, 5, and 1. So 2023 versus 2021, and then we have so over the calendar year that we're reporting on, we were actually down 221 cases. That equates to the 9% call volume that our county showed from a death-related standpoint. Hospice notifications were down 85 cases, equating to 17%. Investigations down 146 cases, 11%. Declines down 104 cases, 12%. Accidental deaths, suicides, homicides, undetermined, and then natural pending were the only two categories that were up. So as we continue, and again, our investigations don't necessarily conclude on the day that the decedent is released to a funeral home's care. So that will be, so that information can change, which is why the health department has access to all of our MDI log and our statistical analysis spreadsheet as we're gained the information, whether it's from toxicology, histology, or a pathologist, one of our locums making an adjustment to, for example, the fire deaths that were in 2023, the children that had passed away. Those are considered our undetermined cases as we're pending toxicology for those. So these numbers will fluctuate a little bit, but as of now, this is where we are with the pending cases and natural cases.
Okay, thank you for your presentation, Mr. Hassett.
You're very welcome. My pleasure. Any questions?
It's good to see those numbers going down, unlike the stock market.
Yeah.
Do any of our commissioners have any questions for Mr. Hassett?
No? All right. Thank you for your time.
I have a quick question.
Yes, sir.
On the physician decline of the death certificate. I see that's an improvement. This is great. Do you feel like that number is average, or is there any way we can help to improve with the medical examiner office from a clinician standpoint?
So if I'm being honest, I think that the reason there's a decline, it's really just in sync with our pre-COVID numbers. So where there was a considerable uptick in the deaths and hospice patients, et cetera, for 2020, 21, 22, 23, I believe that we are just coming back down to our numbers on par. They will essentially continue the upward trend. So if you remove the analysis of deaths from COVID, what can we do from a clinical standpoint? I think that, are you referring to in regards to what a doctor or the health department can do in order to continue the better health in the community? Right. I think that they're on point for that. I think that the health department's been doing a lot with regards to health awareness and giving back and providing to the community. I'd be interested to see what our numbers look like for 2024 as we continue to see COVID fall to the side and the cause of deaths or the amount of deaths continue to trend with 2019 where we left off. So I'd be interested to see what the next year provides. But
Great. Thank you.
Yep. Thank you.
And then just want to put in for Mojave County Department of Public Health, as well as for the county, but just from, as we're the contract administrator, for the medical examiner, just want to report that I know that in 2022, we had some issues that we helped to deal with and to provide information on from members from our community, but I'd just like to note that 2023 was a stellar year. We received no complaints online or really any through email as well. The medical examiner has been prompt to respond to all media, as well as work with the county when needed very promptly, answering phones. And so I just want to report that this past year was a stellar year, and like to commend the work that has been done at the Mojave County Medical Examiner. So
Thank you very much. Thank you.
Thank you. Okay, our next presentation is on the Mojave County Department of Public Health providing vital record services. Dr. Kingsley.
And let me pull this up. There we go. Sorry about that. So wanted to be able to provide just an overview of vital records, which is our death and birth certificates for many of our community members. It's kind of an overview of 2017 to 2023. The information that's being provided, we put together a small report for this, just looking at it, analyzing our own records and the process. As part of ARS, the public health directors of each county are designated as the local registrar that we work. Ultimately, we work under Arizona Department of Health Services and the statutes that define these. This is just basically overall snapshot of what we see here within our community. So basically going over that, we have our history of it. So from year 2005, first we started with death certificates. And then 2010, we were able to provide birth certificates here at the county level, so somebody can come in and receive those certificates, as well as put in amendments here within our offices. Since then, we have progressed where we provide these certificates via mail and drop off, and when able to, being able to provide in-person services. The flow work pre-2018, administration staff, including account specialist and an office specialist, were trained in these certificates. First, birth only and death only, and then since then we've progressed towards being able to provide different services that are part of any of these certificates. From 2018, with that, we've been collecting data as well as supporting the travel services in the outer areas for both our, while we provide the services here in our main office, looking to be able to reach those offices that are reached out in both Bullhead, Colorado City, the Arizona Strip, as well as Lake Havasu City. So currently, right now, we offer birth and death certificates and at our offices, primarily here in Kingman. And so this is part of for this. Just wanted to update over that, and I'll go over those new services or just how we'll be providing the access to death and birth certificates here within the county. But just wanted to be able to provide an overview from 2017, 2023. These were the number of certificates that were processed. So we've seen a steady incline from 15,000 to up to around 25,000. Going down 2023, we're missing some of the data from 2023, but overall, we see that steady incline of the number of certificates, but especially in death certificates, we see that spike right there around 2020, 2021, and going down 2023. And again, we saw some increase of certificates there, tied most likely to the pandemic with an increase of mortality during those times. Birth certificates, we see a small increase. We do see it increasing, but nothing that is shooting or skyrocketing for within our county. So these are just the number of copies issued. So again, from 2017 to 2023, but looking at death in 2017, 15,000. Up to our highest at 25,500 almost, and then this last year about 20,000. And then birth, we're seeing that 2,487 there, beginning in 2017 up to 2,877. So only an increase about 400, but a steady incline there, a little bit, about 100 or so each year or so that we see from that for birth certificates. Also put in there birth certificates that are needed for passports. So just started collecting this data over 2023, looking at individuals that come in to get their birth certificates for passports, just identifying those needs and being able to provide those. That's another aspect, as well as this is a birth certificate is also a form of ID for employment. So it's one of the official forms of ID that somebody can use for employment. So we also feel it's important for that too, to be as people have, our community members have that to be able to help them seek employment. And then overall, just it shows a steady incline of the birth certificates from month to month, kind of overview of what we're seeing on the overall certificates there. And then, so we also do corrections, which is primarily when a mistake is made on death or at birth from the hospital. Those are the two that we process here, and those are put in and we help process those with the Department of Health Services or the Bureau of Vital Records. So overall, just looking at that, currently right now we have one full-time employee in Vital Records, Sherry Walsh. Many of them in our community know her, and she is very active and very beneficial to the program, and her knowledge and operational knowledge of the program and helping that to progress and remain steady. We do have, from that, we have employees. So we have backup employees from myself, Melissa Palmer, the deputy, Jatan Simpson, our executive admin, and Debbie Crandall, and Bridget Hecker, who helps us being able, when we need to be able to cover when Sherry has to either go for trainings down in ADHS, there's yearly trainings that are required, as well as audits and other procedures that need to be taken care of, as well as her own PTO. We do have the dedicated wall space in our WIC lobby here for applications and drop boxes. We recently found that the courtesy hours that we're offering were being confused with the 8 to 5 drop-off box. We do have even with the drop-off box, we do have a really good turnaround time, but we wanted to expand those drop-off boxes. So we are going to be putting the drop-off boxes both in our county buildings, both in Lake Havasu and Bullhead City. They'll be checked twice a day. They'll be scanned in and then sent inter-office mail, and they can be sent back there and a person can pick them up. So this can help on so it can also be mailed back to a person, but if they don't have the money for mailing, they can just come into the office and being able to pick it up there. So we just want to be able to provide those services, more immediate access. Sherry does have great turnaround time, but it is dependent upon her caseload. So sometimes it could be delayed 1 to 2 days, but Sherry tends to maintain a very good turnaround time for that. We do have some constraints with only having one employee for it, but again, as I commend Sherry and her efforts, as well as all the staff, on being able to do that. We also, in Colorado City, we'll also be providing a drop-off box there. And so again, they can mail it in. They can come in and any of these offices and be able to drop off the application with the payment, and we can mail it back, or they can come into our offices and pick them up. And you're going to, there might be same day, but for the most part, we'll be able to provide relatively prompt service, hopefully within the next day or next 2 to 3 days, for them to be able to pick up their certificates. And then there is an online option. Unfortunately, we don't have the online option. It is controlled by ADHS. They have a vital check system that if you can get it expedited to you, if you're not able to come into an office from ADHS, and that is only online, and it does cost, you do have to pay for the expedited service. Other than that, it's within the county. Certificates are available at the county, but not through ADHS Bureau of Vital Records in Phoenix. So they are issued here. So I just want to overall get an overview of that. And then just of note, similar to how we previously went through environmental fees and different points, and depending on legislature, but as of right now, the Vital Records fees that are managed by the state have not been increased for over 10 years. So they have begun procedures on that rulemaking to increase those fees. It may be more of a significant jump, just not a few dollars. So the media might participate in that. If that does, I just want to prepare the board on that, knowing as well as being prepared for that, for being able to meet those needs. By ARS statutes, all vital records are to be funded by fees. So there's that challenge there, that this is a service that's provided, but everything employees, everything does have to be paid through the fees of this. So it has to be adjusted by statute in order to, currently they are in the red and they're getting more significantly in the red. So they need to bring it closer to where they're in the black, and they're working towards that. So, but overall, that's just, I wanted to advise the board of that, as well as our community and of those services. So any questions?
Any questions for Dr. Kingsley? I don't see any. I do have a question. If someone needs their birth certificate from 40, 50 years back, can we obtain that information from Vital Records in Phoenix and then print the certificate out here?
Yeah, so ARS does define who can receive a birth certificate. There are legal means too, if don't meet one of those definitions. So if it's any part that somebody needs to obtain, they might have to go through legal matters, but it is a pretty extensive list of who can receive it. And as long as you can show a relation or correct relation to that person, you can come here and go ahead and apply for that, as long as you're able to show that you have the correct relation defined by the statutes. Tony, did you have any other, that's basically procedure, correct, for legal? Since we have counsel here.
Sorry, that's my understanding. Yes, I was just looking up the statute in case anybody had any further questions on that provision.
Yeah. So a birth certificate or death certificate, any of those, as long as there's a family relation and or able to show that you have a right to it that ARS defines, the years don't matter. So
That's a wonderful service to have here in Mojave County.
Yeah.
You know, it hasn't always been that way. You had to deal with Phoenix, and it was a long, drawn-out process. So.
Yeah. So great.
Very good. Thank you.
And then I have two other updates, if I can indulge the board just a little bit, just a few things that just for director update or department update. Would that be okay? It'll be short.
It's not on the agenda.
Not on the agenda? Okay. All right. All right. Thank you.
Okay. What is on the agenda is official business to come before the board. The first item is the last quarter of the 2023 Board of Health Community Disease Report. Good morning.
Good morning.
How are we doing in Mojave County?
Not too bad. So I'm Anna Scherzer. I'm the epidemiologist. I kind of pull together our communicable disease numbers and counts and whatnot.
I do think we have a handout for that.
So as usual, I've got the quarter 4 communicable disease report. That's calendar year, and it's cumulative. So it's actually all of 2023 there that you're looking at in front of you. And what we have are just a choice of reportable conditions. It's not all of them, but it's the ones that we talk about the most. And I have the counts of confirmed and probable cases in 2022 for the full year, compared to those same counts for the full year of 2023. And then the 5-year median is that last column. And way over on the right, kind of broken apart from the rest of the table, is the number of cases that we investigated. So those are the number of case reports that we received, and we had to sift through and we had to investigate in order to get to that end result of counting them or not counting them. So that's what you're looking at there in front of you if you're not familiar with it. And there's not a whole lot that stands out there. As usual, we've got lots of GI diseases. The campylobacteriosis is the most common cause of diarrhea. And we're testing more and more people, so those numbers are going to go up over time. Influenza's on there, RSV is on there, COVID is down at the bottom, and Again, the RSV numbers, if you compare the 22 case counts and the 23 case counts to the 5-year median, that increase is probably due to these new tests that we have where somebody goes in and they test for flu and they test for COVID and they test for RSV. And so we're accidentally getting more of those cases diagnosed just because of that process. Tuberculosis, there is another one to be careful of. Our active tuberculosis case counts are always low, which is very, very good. But the 5-year median shows up as 0. But the thing to remember with these cases is that they only get counted for us if they were first diagnosed here in Mojave County. And tuberculosis you follow for a long time. If it's an active case, there's a lot of public health involvement with an active case. And so we will have people who may move into Mojave County. They were diagnosed elsewhere. And so we do a lot of work with them, but we don't get to tally that case. So our numbers are usually low. They usually aren't 0 there. There's usually someone that we're dealing with, but we don't get to count them. And the number of investigated cases over there, the 165 that comes with tuberculosis, was, of course, inflated this year because of some potential exposures that we had in a situation last summer that we've already talked about and you're well aware of.
Is that at the schools?
Yes. Yeah, that was the one in the school. And if you happen to look at the last quarter report, which I seriously doubt anybody will, that number, it's 165 now. Last time it was 600 and something. That's because in the background, ADHS, the data system that they use for me to pull these numbers, they actually close out if you're named as a contact to a TB case, but you don't follow up any further. You don't get tested. There's no more action there. They take them out of that system because there's no reason for me to have information on, hundreds of people that didn't really play into the system. So you wouldn't necessarily notice that unless you looked at last quarter. And the only other thing that I will point out, and it's on the back there, is that one of our salmonella cases has been linked to a multi-state outbreak in the United States. And from it has come a food safety alert and also some recalls of foods. And this particular outbreak is still ongoing. There's only 2 cases in the state of Arizona. Our particular case had actually international travel, and they denied eating the foods that have been recalled here. So the charcuterie foods here that have been recalled, the salami and some of the other meats there that were primarily coming out of Costco and Sam's Club. But that's the basis of that. And I don't know if we'll have more cases in the future. This is an old case. It's numbers aren't tallying up quickly. It's just kind of persisting for a while. And that's about all that I had. Nothing really terribly important to talk about or out of the ordinary. Any questions?
And I have a question. I get a lot of people concerned about valley fever, and I see the numbers have increased. Are these new cases in Mojave County or is it cases that are moving into Mojave County?
So,
already
yeah,
established.
The valley fever, which is your coccidioidomycosis there, those numbers are up just a little bit. I wouldn't say that it's a significant jump. Our patterns tend to match what we see in Arizona, so there doesn't seem to be anything unusual going on here. We never know if these are people who had just recently moved here to Arizona, or if they're just winter visitors, or if they've been here and been well established, because it's not part of the normal investigation there. There's very little at this point that we do with a cocci investigation. I know Dr. Wynn has asked before about pulmonary versus disseminated, and we don't even go that far at this point to look into that, partially because there's just so many. The big problem that we have with the cocci cases is that we still don't really well understand who exactly is getting sick or why they're getting sick and where. And I imagine that some of your requests for information come from people who are concerned about agriculture and building and construction and dust up in the air, the human activities that are releasing dust up into the air. And it's just so hard to pin down. There have been situations where there have been outbreaks. One great example is in the state of California. There was a prison, and right next to the prison, they were doing some construction for another building. And the rates of cocci in those prisoners jumped tremendously, from fewer than 20 cases one year to almost 200 the next year. And so that was strong evidence that there was a link there. And then there's been outbreaks that have been considered in archaeological digs in the Southwest. And yet when we go in and we actually try and carry out a study to show that if construction is occurring here, then people nearby are more likely to get cocci than people further away. And when we do those studies, it doesn't seem to appear like that. There was one study back in the teens, I think, that Mayo Clinic did down in Maricopa County, and they had one campus where they were building a new building, and then a second campus 13 miles away. And so they did a real nice study with the employees and looked at the base rate of cocci in those employees in the two different campuses. And then a year after the construction, when it was all done, and this involved moving all the topsoil, those 18 inches where the cocci spores seem to be. And ironically, it was the campus 13 miles away that had more new cases that showed up than the campus that was right there. And I've talked in past meetings about some of the air samplers down in Maricopa County, and they're down there for different reasons, but every now and then they'll do a study and they'll collect some of the air samples and they'll test for different things because they're out there, they're running anyhow. And there was one just wonderful opportunity just that came by complete accident where they had agreed to look at cocci spores that were in the air. And it happened to be at a time period when there was a huge windstorm, one of those haboobs. And so they looked at the number of cocci spores in the air before the haboob, after the haboob, and naturally we would think way higher numbers in the air after the haboob, and that is not what they saw, the exact opposite. So it's hard to pin down exactly what's happening. There's a lot of evidence, but then when we try and actually show it, there's questions about maybe is the cocci not in the soil at the same concentrations? Is it a matter of that? It's quite possible that it's actually the person's makeup and why they're more susceptible as opposed to what's happening in the environment. But the increase in numbers could be a true increase in numbers. It could be a difference in the way that people are reporting. You know, maybe we have a physician who's doing more reporting or a laboratory that's doing better reporting than they had in the past, although we haven't seen evidence of that. And it could just be environmental factors. If those numbers are going up, maybe it is due to the land use. Maybe it is due to the seasonality of the rainfall and us having less rainfall recently. So it's just a tricky one. And with us, although these numbers look pretty good, when you go and you look at a specific site, a specific construction site, or a specific agriculture area, you got to take those numbers and whittle them down. And there's just not a lot of work that you can do with 5 case counts or 4 case counts to show anything one way or another.
Okay, thank you. That's
If I can
interesting.
share a little bit, kind of anecdotal from the clinical standpoint. I believe it's more inflammation than the cocci is diagnosed in the patient. As a pulmonologist, and I work with our thoracic surgeon in the community, we see more inflammation. For example, we meant is that if you have a typical pneumonia, it can become a complicated pneumonia. The fluid more draining, more complications. Sometimes we have to have surgery for the typical pneumonia. On the specimen that we identify, we don't see cocci, but we believe there is a component of inflammation. Living in a community, the fungus live in the environment, so it becomes endemic. And we do see a little bit more. Anecdotally, I said that because that's what we observe. We need to have more, hopefully, literatures and research from academic center, residency program to have more publication. but we do see a little bit more inflammation when you have some sort of pneumonia, and sometimes require surgical intervention, which is drain it and things like that. But with the technology we have right now, it's much better than the old days. So the drainage is pretty less complicated than compared to the old day that when you have to open the lung. Right now it's laparoscopic procedure. And we have that technology here in the community to help out patient. And
That's good. Thank you. Thank you. Any other comments, questions? If not, I'll entertain a motion to accept the community disease report.
Motion to accept the report. Let's.
Thank you. Do we have a second? Okay, we do have a motion and a second. All those in favor indicate by saying aye.
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 Chair votes aye. Motion is approved unanimously. Okay, agenda item number 2. I'm looking for a motion to approve the minutes for the July 24th and October 23rd, 2023 minutes.
Madam Chair, I do have a correction on October meeting. I was present via phone at that meeting. It's showing me as being absent. I suspect during the roll call when I answered present that the present didn't get through to everybody here. You probably didn't hear it, but I was present via phone. And just not another correction, but just a comment with regarding the report on the TB exposure response. I wanted to say I was very impressed with the department's response to that, to the TB incident. I wanted to say that, and I was also very impressed with the after-action report that Scott Bright put together. I thought it was a model after-action report, and not only saying what happened, but what went right, and the lessons learned that can be learned from for next time. So congratulations on that.
Okay, so we need the motion amended then to indicate that Byron was present at the October 23rd meeting. Can you amend your motion to take in that?
I'd like to amend my motion to amend the conversation as outlined in the minutes. Let's.
Okay, thank you. Now a second. I second. Okay, have a motion and a second. Any further discussion? If not, all those in favor say aye.
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 Chair votes aye. Any opposed? Okay, the minutes are accepted with that correction. Okay, item number 3, approve the Department of Public Health activity reports authorized by the Public Health Director from October to December 2023. Okay, do I hear a motion?
I'll let the motion.
Second.
We have a motion and a second. All those in favor say aye.
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 Any
Aye.
opposed?
Aye. It's worthwhile.
Chair votes aye. Passes unanimously. Okay, the next item is discussion of possible action. Approve the recommendation of the Board of Supervisors to approve the 5-year intergovernmental agreement with the Arizona Department of Health Services for a grant to reimburse Mojave County Department of Public Health for its Sexually Transmitted Infection Investigations Program under the contract number CTR 068169 for an amount not to exceed $110,445 for the 2024 calendar year. Wow, that's a lot. Is there any discussion for this agenda item? If not, I'll accept a motion. Do you have anything to present, or were you just here to answer questions? Okay.
So moved. Let's.
Okay.
Second.
Have a motion and a second. All those in favor say aye.
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 Any opposed? Motion passes. Thank you. You got off easy. Item number 5 is the discussion of possible action. Approve the recommendation to the Board of Supervisors to approve the Mojave County Overdose-2- action and state opioid response contract number IGA 2021-072 amendment or possibly a similar new contract for fiscal year '24. So I have a question there, or possible similar new contract. That's a little confusing.
So we included the previous contract. They have not issued a new contract, but we know it'll be coming before our next Board of Health meeting. And we can put it off till then and just bring it back to the board at that point if you want to see the new contract, but it'll probably go before the Board of Supervisors before the next Board of Health meeting. It should be identical. It's just going to be a decrease in the amount of money that they're giving us.
Okay, I think we can go forward with that. If we need to change it, we can bring it back for ratification.
Yeah. If there's significant changes, then we would bring it back. We wouldn't put the recommendation of the board, but if it's similar and only a decrease in funding, then we would put it forward towards, we would use the Board of Health's recommendation.
Okay. Do we have any questions from any board members? If not, we're looking for a motion to approve.
I would like to motion.
Second?
Second, Litz.
We have a motion and a second. All those in favor say aye.
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 Just do the standard registration for request to speak.
Any opposed? Okay, motion passes unanimously again. Next item, number 6, this will be a discussion of possible action to approve the recommendation of the Board of Supervisors to approve the new initiatives of hiring senior site coordinator for Lake Havasu and office specialist for Kingman, paid in part from senior programs from the Lake Havasu City Fund and in part by Western Arizona Council of Governments, fiscal year '25, with no impact to the general fund. Any questions?
This is just for reference. This is just so the Board of Health does oversee our budget, which we bring to you in our April meeting. But as part of our budgetary planning for the upcoming year, for fiscal year '25, we did put we put 2 new initiatives in, but it has no impact to the general fund, but there are challenges to our general fund budget this year. So we just wanted to be able to put that forward, but again, we were able to budget appropriately. We are at a critical point with our senior centers on being able to correctly staff them. So we were able to review over the budget and make where we could to be able to accommodate without an impact to the general fund budget. And there's a reason that since no new initiatives are one of the challenges for the upcoming budget for the county, we just went on to also bring it to the board for that recommendation as part of the board's duty for the budget.
See no questions, so I'm looking for a motion to make that recommendation to the Board of Supervisors to approve the new initiatives for hiring the senior site coordinator.
I move to approve the recommendation.
Okay, we have a motion. Do we have a second?
Coyle, second.
Thank you. All those in favor say aye.
Aye.
Aye. Aye. After that period.
Okay, motion passes unanimously. Going on to the next and final item, number 7, discussion and possible action, provide a recommendation, if necessary, to the Board of Supervisors regarding Mojave County's non-mandated essential services of vital records performed and operated by Mojave County Department of Public Health.
And sorry, this is just off my presentation. If you'd like to take any action on that information that was provided, that's what this would be.
I don't see where any action is necessary on this.
Yep.
Okay.
Great.
Motion to adjourn.
Thank you.
That was quick.